Well, a cancer diagnosis is devastating, but there's one cancer treatment center here in the Valley that is giving cancer patients new hope. It's called Phoenix CyberKnife Center, and Dr. John Kresl joins us now to tell us more about why the center is so unique. Well, welcome to Sonoran Living.
Oh, good morning. Thank you for having us.
Oh, well, thank you for being here, because certainly anyone, and who hasn't been touched by a diagnosis of cancer at some point in time in their life with their family members, are always seeking out new information. So tell us about the Phoenix-based CyberKnife and what makes it so unique.
Well, sure. Well, I and my partners have been practicing with Radiation Oncology for a number of years, and we saw that there was a big need to actually bring radiosurgery and the most advanced radiosurgery to the Valley. So that led us to try and develop the center, which is the state-of-the-art center for radiosurgery in the Valley, and in fact for the Southwest, and involves the use of CyberKnife and the TrueBeam STX, which are two different treatment platforms that we have at our center.
What exactly is CyberKnife? Is it a technique? Is it a tool?
It's a treatment platform or a treatment machine.
Okay.
CyberKnife is kind of a catchphrase for a type of radiotherapy that's very precise, very high doses. It gives a surgical response, but there's no cutting, there's no needles, there's no invasiveness. It's a new form of treatment that's been developed over the last 10, 15 years.
Wow. And you're the first one to bring it to Arizona?
Well, the CyberKnife is unique to Arizona, or the Phoenix CyberKnife is unique that we have the latest CyberKnife and a TrueBeam. So there's two different devices that allow for every type of radiation therapy in one center. So a patient can be offered whatever's most appropriate. They have no limits on the type of treatment that they could be offered at our center.
Now, what type of cancer patients will actually qualify for this type of treatment?
The short answer is every type.
Okay.
Okay, from brain, from the top of the body down, radiosurgery can be delivered for the appropriate patient. So there's really no specific type, but we typically will treat brain cancers, breast cancer, lung cancer, kidney, prostate. So again, it's not for every patient, but we don't have a limitation on the disease site or the disease diagnosis. It has more to do with the individual patient's case.
Oh, new hope, absolutely, for individuals out there who are faced with cancer right now. What about the side effects? There are certainly some. What would they be?
You're right. Every type of treatment for cancer has some type of side effect. And compared to standard radiation therapy, which is usually daily treatments over 6, 8, 9 weeks, radiosurgery is all done in a week or less. Many times we're treating them in just 3 days.
You're kidding me.
And the big difference is the precision, and hence the name radiosurgery. So now we're condensing 9 weeks of radiation therapy into perhaps just 3 days. And that's because the precision is so high, we can now deliver all of that dose, concentrate it, kill the tumor, and we spare or we protect all of the surrounding normal tissue. So the side effects are quite a bit less.
What about the success rate?
Well, again, depending on the actual diagnosis or the treatment site, the success rate can many times be as good or better than surgery. In fact, right now we know that for early stage lung cancer, and a lot of the lung cancer patients, we're comparing it head to head to surgery because it's as good as surgery without all of the invasiveness.
I mean, it sounds amazing. And for someone who has experienced downtime in the past through surgery and other invasive treatments, this sounds like a dream come true.
A lot of times patients are pretty amazed. They ask, are you actually even really treating me? Because we'll treat them in the morning and they'll go golfing or shopping in the afternoon.
That is truly amazing. Now, what about insurance? What type of insurances? Well, do you have to be specially referred, or if you have insurance, can you just make an appointment and come in for a consultation?
Good question. Well, referrals are usually coming from the patient's own physicians, but many times physicians don't even really understand or know if this is appropriate for the patient. So a lot of self-referrals, we're happy to take questions and help them understand if they're appropriate candidate for CyberKnife or not. And as far as insurance goes, I mean, it's covered by Medicare. I mean, it's FDA approved. This is the most rapidly expanding form of radiation oncology in the country. So many times we just have to work with the insurance companies to get it covered.
Oh, man, so many more questions. And good thing you're going to stick with us for a little bit this morning, right? And answer some more
Absolutely.
questions coming up. Excellent. If you want to know more about Phoenix CyberKnife and the Radiation Oncology Center, they're located at 4611 East Shea Boulevard in Phoenix. Their phone number is 602-441-3845. They also have a website, phoenixcyberknifecenter.com. And thank you very much, Doctor. You will be sticking around answering more questions coming up.